my show. Hi, I am Sarah.
Hi friends, we would like to welcome you to Sarah's Great Day. It's another season and we are so excited because we have a special guest, don't we, Sarah?
Yeah.
Can you say her name? Can you tell our friends who this is?
It is Dr.
Akanli.
Huntley.
This is Dr. Akanli, pediatric pulmonologist at Peyton Manning Children's Hospital, St. Vincent here in Indianapolis, and we are delighted to have you on the show.
Oh, thank you. Lovely to be here.
Well,
thank you. Thank you for inviting me.
Well, we are really excited to have you. Before we get started with you, Sarah, would you like to tell our friends what we're going to make today?
Yes. We are going to make lasagna cupcakes.
They're lasagna cupcakes, and they are so good. We served them for the Colts game last night, which was horrid, right? We didn't even wear our Colts shirts tonight because we're like, ugh. But they're little mini cupcakes made with, lasagna cupcakes made with wontons, and they are so good. So that is what we're going to make today. We'll see how we do because Dr. Akanli just has a lot of great information to share. So we want to do both because it's fun to cook with friends, right? Mm-hmm. And she is like one of our best friends now. Mm-hmm. So you can get the recipe for the lasagna cupcakes on Sarah's website, which is www.sarahsgreatday.com. So let's get started. One of the reasons I had Dr. Akanli come today is because there's been a lot of traffic on social media about sleep apnea and sleep studies for kids with special needs on the boards that I follow. And there's just a lot of questions. And Sarah ran into some real issues this last year, and that's how we met Dr. Akanli. And so I want to ask you, you're a pulmonologist, and I was kind of shocked by that. I would think an ENT would do sleep studies, but it's a pulmonologist. Can you tell us?
Yeah, from the sleep study viewpoint, any physician that could order a sleep study, but usually the diagnosis and the treatment part involves pediatric ENT or pediatric pulmonology physicians. This mainly for sleep-related respiratory problems, such as obstructive sleep apnea. The first line of therapy of obstructive sleep apnea in our children is tonsillectomy and adenoidectomy, where the ENT doctor comes into picture. But once the tonsils and adenoids are removed, unfortunately, some children will still continue to exhibit signs and symptoms of sleep apnea, which needs further evaluation. And at that point, pediatric pulmonologist with further specialization in sleep medicine comes into picture.
Right, so you read Sarah's sleep studies.
Yes, I read her sleep study.
That's who does it. It's not an ENT, although we did see an ENT before we saw you, and Sarah's had her tonsils and adenoids out, but that did not help us. Okay, we're going to just get started on our fillings really quick because I could just sit and talk with her all day and then we won't get our little lasagna cupcakes done. So the first thing that we're going to do, Sarah and Dr. Akanli, can you guys work together to get a cup of mozzarella cheese?
Yeah.
And we're making the ricotta filling. We've already made the meat sauce.
Sure.
So Sarah, do you want to do that together?
Yeah.
All right.
I'm going to spray a muffin pan, which is where it gets the cupcake sound or name. You can't go over here.
Hopefully I won't make a mess, huh, Sarah?
Okay. So, Dr. Akanli, I know, like for Sarah became very fatigued and, okay, we have to get that all the way to the top.
Okay.
Sarah became very fatigued and her hemoglobin, is it dropped or went up?
It was up.
It was up. Okay, so her hemoglobin levels are really high. They think it's her heart. We verify it's not the heart. And Dr. Escobar says, I think you have sleep apnea. And I said, no way. because I slept with Sarah on spring break and she was fine. So can you talk about how it can be very hidden?
Sure,
Sarah, you
sure,
wanna do-
definitely. Sleep apnea signs and symptoms, when I talk to my patients about them, I usually like to divide them into a nighttime and a daytime symptoms.
Okay.
Nighttime symptoms mainly being snoring, mouth breathing, restless, tusses and turning, excessive sweating, frequent awakenings. Sometimes I see children with lots of nightmares, night terrors.
Now Sarah did have that. You had nightmares, didn't you, Sarah?
Yeah.
Sarah is measuring 1 cup of ricotta cheese. I'm shredding Parmesan.
Bedwetting, which
Okay.
once they achieve the good bladder control, but then for unknown reasons, then they start wetting their bed again.
Okay.
And
Ooh, that's not good, is it?
struggling to breathe, stop breathing, gasping. Sometimes the families actually see the apneic pauses during sleep. These are the most common nighttime symptoms, and also difficulty waking in the morning. No matter how long the child might be in bed for 10, 12 hours, they just don't get a good night's sleep. Their sleep is fragmented, so they're
Okay.
very tired. They feel fatigue and they just don't want to get up because the sleep was not refreshing.
Okay.
Then the daytime symptoms, which is, I think, very important to take into consideration also, behavioral problems,
Okay.
learning disabilities,
Yep.
school problems.
Yep.
Children, when their sleep get disrupted, when they don't get a good night's sleep, they can either get sleepy, like adult does, take naps, but majority of the children actually do go the other direction. They become very hyperactive.
Okay.
Difficulties with focusing, inattention, and irritable. They just not happy.
Right.
And
that's what we noticed. You know, we thought Sarah's heart was going bad because she had had surgery when she was little, and that was the first thing that they decided to do was check her heart, which was fine, but it was just like she was just here. She wasn't part of the world. Sarah, do you remember how tired you used to be?
Yeah.
Do you wanna mix
remember.
that up?
you were falling asleep in my consultation, Sarah. I remember that. And it was, I think, early in the morning, if I remember correctly. So
Yeah, and when I came to your office with my husband and Sarah, we kept telling you that we shouldn't be there because Sarah didn't snore and she slept through the night.
Yeah, Valerie, I'm so happy you're saying that. If you don't mind me interrupting
Yes,
for 1
please do.
second. Absolutely. So all the signs and symptoms that I mentioned, if they're there, they're pretty obvious.
Yep.
Parents come to me, oh my God, I'm afraid my child stopped breathing during sleep. But it's not always that clear cut. And majority of the time also, you know, we parents sleep in our room, children
Yep.
are sleeping in their room.
Yep.
Unless they're heroic snorers shaking
Yep.
the whole house, you might not necessarily hear them snoring. And
Yep.
snoring is not the most common sign and symptom, but it's not the only sign. And sometimes when the obstruction is so severe that you don't hear any snoring.
Dr. Escobar thought she had central sleep apnea. Which she did not. She
did
had
not.
obstructional, even though she didn't snore or do any of those things. Can you explain to our viewers the difference between obstructional and central sleep apnea?
Absolutely. Central sleep apnea, you know, our breathing is controlled by the our brain, which is located in the brainstem, periodically sends our lungs and our muscles to signal to breathe. In central sleep apnea, the brain does not send that signal.
So it has
And
nothing to do with an obstruction.
It has nothing to do with an obstruction, completely different phenomena. And unless it's congenital, central sleep apnea is quite rare in children.
Okay.
We can see that in adult patients with heart problems. I'm sorry, Sarah, I'm not really helping you at all. I'm just talking.
Here, we're gonna start let me interrupt just really quick and then I
Sure.
want you to keep going. We're just using wonton wrappers, okay? And we put one on the bottom, and then we're going to take turns putting sauce, a little bit of ricotta. It's a ricotta parmesan, mozzarella cheese, and then we'll put another layer. So this is great sequencing to teach your kids, you know, wonton, meat sauce, ricotta, wonton, meat sauce, ricotta. So it's great for that. So let's do that while we're talking.
All right.
If you guys will put the meat in, I'll do the ricotta. Okay, so you said it's central sleep apnea is very rare.
It's rare in children. There are congenital forms of central sleep apnea, but that's also quite rare. The most common sleep apnea in children, obstructive sleep apnea. And then there is a respiratory effort, but unfortunately either no air is going in and out of the lungs or very little air is going in and out of the lungs.
And you can put a little bit more in there, Sarah, if you'd like.
Yes.
Now, I just don't understand, like, how did Sarah not snore and have obstructional sleep apnea?
Yes. What Sarah was doing, her body, especially her upper airway, is found a way that to keep the airway in a certain position as open as possible to minimize the degree of obstruction. This is so important, especially our children with Down syndrome. They have unusual sleeping position. They may like to sleep on their belly.
Okay.
Or they may like to sleep bent forward at the waist.
Yes.
And pushing the head down.
So doing the little pancake over your waist. Yep.
Or sometimes they just like to be propped up 2-3 pillows or extend the neck as much as possible. This allows them to basically, they find the best sleeping position to allow them to breathe in and out better as much as possible.
Okay.
So that can minimize the obvious signs and symptoms.
Okay.
And also, when the obstruction is pretty significant, sometimes there might not be airflow. And so you may not hear anything because there is no air exchange.
Okay.
So snoring is an important sign, but if it's not there, it doesn't necessarily rule out obstructive sleep apnea. I always say snoring is not a laughing matter anymore.
Okay.
It has to be addressed. It has to be looked into.
Okay.
There are some pediatric studies, pediatric sleep medicine studies indicating even just snoring without the evidence of sleep apnea can have neurocognitive deficits in children, even primary snoring.
Right, and I believe this since Sarah has been, and I'm going to show her your machine, not right this second, Abby. Our director, Abby, is going to bring it up to us when I show it to you, but I think a lot of people think these machines are these big, you know, scary machines that are loud and have this mask. But they are very, very different now, and I'm going to actually show you what they look like.
Yes, fortunately, Field made a great progress on that. Not just only the machines, the masks that we use. It's
silicone,
children-friendly, soft.
But Sarah's whole life changed when she, when we realized Sarah had 16 apneas in 5 hours. She had 6 minutes of REM sleep in her sleep study. Which, by the way, she did. I know everybody's afraid of the sleep studies. Sarah did phenomenally well. She had no problems. You want to put wonton wrappers on? You know what we have to do? We have to put a little piece of basil on the top of the cheese. And this just gives it some more flavor. And you can even put a little bigger piece, like the size of a quarter. Okay. Sarah obviously is not as tired as she used to be. Her speech improved. She's at the high school now, so she walks all over that high school, so she's in better shape. But it's like we got our daughter back, and that's why it was so important. My. Yeah, oh my, here. And that's why it was so important that we had you be on the show, because it really, truly, it changed your life, didn't it?
Yeah.
When you told me something that I did not realize, there's new recommendations for sleep studies for, now this is for kids with Down syndrome?
For children with Down syndrome, American Academy of Pediatrics, I believe in 2011, recommended in their guidelines surveillance sleep studies starting age 4 and up.
Okay, did you hear that? starting age 4, people, you should be doing a sleep study if your child has Down syndrome.
They recommend, because their explanation behind that, there has been a unfortunately poor correlation of parental reports of sleep apnea, just like you're saying, for the reasons that we just discussed, and the presence of sleep apnea. There was, in fact, just like you all went through that, it was a big shock that it's in a way
we
it's
just had no idea.
Yes. So those recommendations are out there.
And you can have some really serious complications from extensive sleep apnea.
Yes, you can.
And you were telling me, pulmonary hypertension. That's bad stuff.
It is very serious, very serious. Both medical and behavioral complications, learning disabilities, failure to grow. Developmental delay, and Sarah went through that, her hemoglobin level was up because she was having low oxygen levels due to sleep apnea in her blood. And her body actually was responding to those low oxygen levels, making more red blood cells, try to get her body keep being oxygenated. So yes, pulmonary arterial hypertension, which is the pressure in the pulmonary arteries goes up due to working so hard to breathe. And which can also cause systemic hypertension. So it can have very serious medical sequela.
I mean, it's like, seriously, new person. Skin is better, hair is better. And so we just really
Sleep matters.
It really truly does matter. I'm going to pop these in the oven really quick, and then I'm going to ask you, I'm going to talk about the different machines. Okay. Oh my gosh. Let's let those cool. These have to sit for a second, so before we dig into those, Abby, do you want to bring up the We actually have a BiPAP machine.
Correct.
Okay, this is it. And, I'm going to, first of all, it's the nose mask is right there. And that is so soft. It's silicone. It's so soft. This is velvety, soft stuff. But I want you to listen to the machine. If you think these machines are loud. Okay, now this would be like this, so you can't hear it. You can't hear it, and I've got all of these super microphones. Quickly, can you tell our listeners or viewers the difference? This is a BiPAP machine versus a CPAP machine. Okay.
The CPAP and BiPAP, they both apply the similar way with the tubing and a mask. We have different kind of masks, and I would strongly advocate every child to be fitted for a mask and special tubing that fits their face shape.
Okay. Which you guys did for us.
Yes. Before the further studies, before we start utilizing it. CPAP applies just one continuous pressure to the airways. BiPAP applies 2 different levels of pressure. When one taking a pressure breath in, a little higher. When you're exhaling out, a little less, so that the person does not feel like they're exhaling in a very high pressures. In Sarah's, in Sarah, I wanted to go with BiPAP first, or BiPAP was my modality of treatment choice because her carbon dioxide levels were also increased.
Okay, so her CO2 levels were high, so she's not getting that out.
Exactly, she wasn't picking up oxygen and not getting the CO2 out, again, purely due to obstructive sleep apnea. So, and the BiPAP, in my opinion, is somewhat superior to bringing those numbers to normal levels. And I feel tolerance might be easier, especially if very high pressures of CPAP needed.
Yeah, and Sarah did a CPAP titration, which is where you go in and do another sleep study, and she failed. So, Sarah, I want you to tell your friends, Does the mask bother you?
Yeah.
Well, does it really bother you? I mean,
No.
no, because you sleep with it every night, don't you?
Yeah.
And we worked really, really hard to get you to get used to it, because you have to get used to it, don't you? Mm-hmm. But do you feel better?
Yeah.
Do you? Mm-hmm. Yeah. And it's okay, isn't it? Mm-hmm. It doesn't hurt, does it? And when you went in to have the sleep study and they put all those wires and everything on you, did that bother you?
No.
No, it didn't. She just put them on, and I actually have a picture of it. I'm going to try to find it so we can show if it's okay with her. But she just didn't much care. It was great. So
I think I would recommend to everyone and whom orders a sleep study on a patient of theirs, definitely to inform the child and the family what the sleep study is going to entail. Because you're going to be in a different environment, it's not your own room, bedroom, and we always want one caregiver to be with the child in our pediatric sleep center. I have my little baby doll also with all those 12, 15 different things attached to that baby, and I show that to my patients. I say, this is what we were going to be putting on you, but touch, nothing hurts. It doesn't involve any radiation, no poking, no blood, nothing is involved.
It's just being hooked up is what you are. And you're in a different environment.
I think if you explain that to the children and the caregivers so that they know what they're up to. And I think our pediatric sleep technicians also do a great job.
Oh, we've had, I think it's Simona.
Yes.
Her.
Yes.
We love her. We've had her both times.
Yes, she's wonderful.
Like, we just love her.
She's
she
wonderful.
Is so
They're
sweet.
so good working with children. They take their time, and
you know
they just
what,
do a
your
great
staff,
job.
I have to tell you, if you're concerned about this, again, Dr. Akanli is here in Indianapolis, but I know you could call her office and set up an appointment with her. But she's phenomenal. Your staff is phenomenal.
Thank you. They are. I'm
are
very
so
proud
good.
to have them as. We work as a team.
Yes.
This is a team approach. It's not only me. It's my respiratory care practitioners, my nurses. My sleep technicians in the sleep lab.
Yeah, it's
a team approach.
It really is. And like the way they fitted Sarah with her mask, they were so nice there. And as far as being the parent, they call me, I swear, like every other week. They're like, how's it going? Sarah's numbers are good, and blah, blah, blah. But you can contact Dr. Akanli, and I'm going to put this in the description below our YouTube video. Her number is 317-338-2825. Thank you so much for coming here. This is just such an important thing. And we probably shouldn't have cooked. We probably should have just sat.
Oh, no. This looks delicious. I'm glad we did.
This is so good. And we were going to have kind of like a Super Bowl special, but we didn't get there. The Colts got spanked by the Patriots, didn't they? Sarah, before we go, was it a good day or a great day?
Great day.
It was kind of a quiet day for Sarah, wasn't it? But it was a great day. Dr. Akanli, thank you for being with us.
Thank you. Thank you for having me. I'm so happy to see that she's doing wonderful.
She is, because you saw her when she was so tired.
I did.
We would love for you to join our YouTube channel, Sarah's Great Day. In addition to that, we've got some new shows coming out this season, some parent interviews where we're going to sit down and talk with families that are in different parts of their journey that have kids with special needs. I'm excited about that, and just some other little things that we're going to do. So we're really excited. Again, we want to say thank you to the ARC of Indiana for your grant, which has allowed us to get some great equipment. So you're going to notice some really high quality. But please subscribe to our channel. We'd love to have you. And let's dig into these lasagna cupcakes. They're phenomenal. Are you ready?
Yeah.
Okay, let's go.